I'm Nora Baba. I'll be talking about the sports psychology and post-op knee construction rehabilitation. This class is for advanced study and sports and exercise psychology. So my population, as I said, will be the rehab post-op knee reconstruction surgery. So according to our researcher, the individual's rehab program should consider a variety of environmental aspects that have an impact on their ability of function and then their ability to live independently. This will also affect their engagement in society, their mental health, and most importantly, their ability to function again. So after surgery, it's very crucial for the patient to take care of their emotional health, but also for their mental health during that time period of going through surgery and rehab. So the post-op rehab is a program specially created to restore strength in the muscles and in the joint functions. Guarding against respiratory issues, boost range of motion, provide the patient the assurance that they can lead a full life once they completed the rehab itself. In other words, after the rehabilitation programs are designed to give patients the encouragement and ability from any physical illness or accident of full recovery, including both their physical and mental capacity. So the reason I chose this experience is because I work at a physical therapy clinic with sports medicine physical therapists, and I see a lot of post-op knee construction patients come in feeling depression, anxiety, stress, all resulted through this unexpected diagnosis and a long-term recovery plan that they're going through. So it's not only just for the non-athletes that go through this, it's also through athletes, elderlies, obese people. They're all included in this rehab center. But most importantly, my main focus will be for the non-athletes generally during this post-op. So I'm hoping when I become a physical therapist myself, I can lessen the anxiety that the patients have during their post-op rehab. So the 5 factors that I'll be kind of focusing on that will be affecting their health and performance would be their cognitive ability, physical ability, their social support and motivation, and the lack of time. To start off with, I'll be talking about the cognitive ability. So their cognitive ability will include their anxiety and depressions in a relative frequent mental health condition that has significant negative impact on exercise motivation and rehab. Depression produces present intensity anxiety feeling for many people to concentrate on anything, especially on rehab for serious procedures. This also goes along with exercise anxiety that can be triggered by concerns about achieving goals. One looks social acceptance and utilizing the time to exercise rather than doing something else. Those 2 factors can be very big when dealing with someone in the rehab center. So the reason I'm dealing with this is because anxiety thought waste of energy induces worry and divert the exerciser from their intended activities. These 2 main topics, anxiety and depression, can get to somebody who would quit rehab and be like, this is not working for me, I don't like it, this is how it's making me feel, and just overall it will backtrack them in their progress of rehab. So the reason I include this because it's not only a big thing, but it's also, according to another researcher named of Thomason, 10.3% of people who underwent knee surgery experienced depression. On the other hand, if you also have emotional symptoms of postoperative depression, such as feeling helplessness, aggravated, or overall absence of interest in activities, that can also be a bigger issue. So the ways to overcome this is using the self-efficacy theory and support group. So using the self-efficacy theory is like self-talk, self-confidence, building that support group that you have, family and friends. Those things will help you overcome those anxiety and depressions in the rehab area. My second one will be talking about the physical ability. So there are some physical limitations, are internal and perceived barriers that can be problematic if of a medical professional, such as a physical therapist starts a physical health program without first counseling the patient. So the postoperative includes which are becoming physical contracted from surgery. Physical activity might be unpleasant. So according to another researcher, Pellegrina, pain may be a prominent part in the endurance of exercise among postoperative patients, but once it does so, other factors may take its place. The fear of experienced pain or the potential harm stems only from a lack of confidence to try to overcome. So the reasons of why I include this is because the method of building mental toughness may be beneficial for the patient whose face is physical limitation. Also, a multidimensional strategy can help patients perform better and gain more confidence and willpower. So ways to overcome this would be taking medication prior coming to physical therapy, and that's why we kind of tell our patients when they come in with knee surgery is take medication, because we're going to be yanking on that knee, pulling on that knee, and that's not going to feel pleasant to you, and you're going to have that barrier of tendency, and you're not going to let us do anything to that knee without having that release. And using experience as growth. So this could be an iffy one. Using experience as growth, this could be kind of setting an example of a physical limitation you had before, or is this for your first time, kind of as a physical therapist expressing that to you as a patient, and that will be helpful as well. Social support is another big one. Social support can come in form of verbal or nonverbal action, such as offering you words of encouragement, helping with transportation, or acting as a caregiver for you during this difficult time. Now, this can be through your family members, friends, co-workers, anybody to help you through this tough time, getting you to the rehab and dealing with that post-op rehabilitation, because you would need that. Every person going through major surgery definitely needs a social support with them, because it's not fun dealing with that alone. So according to Butworth and Dishman, a social support can range in frequency, durability, and intensity, and includes both official and unofficial comfort aid and or information from individuals or groups. So another researcher, according to Walker, a lack of support for patients whose desire is to return to normal life or return to any activity caused several patients to lose motivation and finish their recovery. So without that social support from family members or friends, their ability to continue on with the program of recovery may lack them and set them back even more, making their knee program or life more difficult. So ways to overcome this is positive reinforcement, goal planning, and more information about the advantages of exercise into practice. So goal planning is a major one. So goal setting can help a patient achieve and keep them motivated in a rehab area. And that can come from the physical therapist, the surgeon, family members, even the patient themselves. Let's say they want to get back to football. They're going to be their goal to get back to that position. Lacking time and motivation, that can be a kind of a big one there. So what I mean by lacking time and motivation is, according to our book here, beyond the actual workout time, there is a lack of time. It may also include the time required to get to and from a rehab clinic, the time required to complete other worthwhile tasks linked to work, luxury, family, and hobbies, and the time required to complete other everyday tasks that call for adjusting one's schedule. So motivations can help a patient stay committed to their exercise remedy because it enables them to focus on their ultimate goal and to feel both internal and external motivations to do so. It's crucial that the patient is consistently monitoring self-imposed objectives in order to enhance those exercises. So motivation can be a big standard one, a way that physical therapists can kind of show their patients, hey, this is your goal. We're going to get there week by week. This is the reward you'll get out of it, which will be playing football, playing soccer, running with your kids, playing sports, anything that can get them back to keeping them motivated into the rehab is a way that we can do that with a patient. So the reason why I included the lack of time and motivation is because post-operative rehab, they can have the feeling of missing out on activities with their friends and families that we're taking. So setting that time in their rehab to be like, hey, it's okay, you got this. I know it's going to hurt now, but in the long run, you'll be grateful and experience those times with friends and families, those activities that you've been missing out on will be still there at the end of the time. So I want to take it before I conclude. There's a section that I want to talk about the bibliography, that there are 3 major references that I want to include that really helped me with this research. The first one was the Psychology Rehab from ACL. So anger, fear of harm, depressive mood, and post-op stress disorder symptoms are all treated with cognitive behavioral therapy. Disordered cognitive are the root cause of depression, mood states, and poor behavioral patterns. Breaking the client's pattern of unhelpful thoughts, actions, and feelings is the aim of the therapy, and which was used in the post-traumatic stress disorder and the deed of getting hurt again. The next one would be also from the psychological factors associated with the ACL. So after the ACL reconstruction, the patient's view and functional outcomes are strongly correlated with psychological variables. This study aimed to link between self-esteem, loss of control over one's health, and psychological distress and patient-oriented outcomes, objective clinical results, and return to activities or their daily life. Those 2 aspects really helped me kind of understand what their psychological thinking were when a person goes into the rehab position. And lastly, by this researcher, Raymond Pascua, patients who have an ACL injury may experience depressive symptoms, particularly in the first 6 weeks following ACL surgery, which is correct. We'll be dealing with that. Patients dealing with this type of recovery are dealing with a lot of pain, and they were likely amateurs who have a hobby or activity they enjoy. So according to the researcher, depression has been linked up to 34% of ACL injuries, whereas after a musculoskeletal injury, the frequency of depression has been linked up to 45 of the cases, so 16, which is greater than the greater general amount. So ACL is a very major depressive thing, so dealing with that, it's very hard. So with my conclusion here, recommendations I would advise my patients would be have a social group that is supportive and understanding, and then build a self-confidence and motivation to achieve your goals, and then be open and committed to all medical professions. I cannot stress this enough when I'm dealing with patients myself, with people who come in with knee post-op, is that they're not as communicative as they need to be. They will say, yeah, I'm fine, I can deal with it, but they're in excruciating pain when dealing with those exercises, because those times can set you back. A thing I kind of learned through this class is and what I want to give to my patients when I become a physical therapist is the model and ideal theory factor, which is a way to build self-esteem and self-talk to help achieve those goals and motivate throughout rehab. As a non-athlete rehab who is experiencing a post-op ACL reconstruction, it's definitely hard to have self-esteem, because going through a process like a patient has to physically and mentally be prepared. These patients are trying to maintain a healthy habit by staying motivated and active throughout the rehab process. And so exercise self-esteem has been demonstrated to be a significant predictor of exercise behavior and adaptation and maintenance. So the exercise self-efficacy should be evaluated and improved, because it will increase the likelihood the patient will follow through their doctor's recommendations for exercise rather than ignore and decrease their ability. With that, it's a good Bible verse to end on would be Isaiah 41:10. God strengthens you, which is, so do not fear, for I am with you. Do not dismayed, for I am your God. I will strengthen you and help you. I will upon you with my righteousness right hand. So what this is talking about is like God has promised to give us his power. He won't ever subject you to the challenge you can't manage, and you have access to God's power at all times since we are with his child. You have to believe that God will give you the strength and power to push through your toughest battles and achieve those goals you put yourself through. He'll never, like, the biggest quote you'll ever hear is, he gives the battles to your strongest warriors. And I do believe that, because he would not do that to you without knowing that you are powerful and have the strength to overcome these. These are my references. And thank you so much.